to Dr. John McDonald's strong passion for improving emergency medical care, Sonoma County was without an emergency department, paramedicine, air ambulance, and a trauma center. Because of this, there was a delay in care of critical patients. Linda Anderson, emergency department, registered nurse at Memorial Hospital. She flew for REACH Air Ambulance and later became a clinical director at Santa Rosa Junior College Public Safety Training Center.
Well, you're doing a broad about EMS and the trauma system, but I think you really, the one thing, and you're probably going to do this, is to really highlight that I don't think we'd be where we are without Dr. McDonald.
Yes.
And he was a visionary, and I think that's the word I would use for him, as a visionary.
Yeah.
A curmudgeon. And, he scared, you can probably talk to everybody who's worked with him will say he scared the what out of us, but he made us better. He made us better practitioners.
Dan McDonald, son of Dr. John McDonald and vice president of REACH.
My father, boy, I'm trying to figure out how deep to dig, Maggie, and what, no pun intended, but what old wounds to open, so to speak.
Jan Bennett, registered nurse at Memorial Hospital in the emergency department. Jan also flew as a REACH nurse and later became the director of trauma services at Santa Rosa Memorial Hospital.
The designation of Memorial as a level 2 trauma center was a major turning point for the county, for our organization, and for the Northern California region. Dr. McDonald was, he was pushing for a trauma program when I first started in the emergency department. And he was pretty aggressive in trying to get surgeons to get on board. But, there were so many layers to putting together the trauma program that, I think that part, Dr. McDonald wasn't going to be successful until he had the backing of the organization. They were willing to put the money and the personnel, put everybody behind becoming a trauma center.
Dr. McDonald had a saying of do the right thing for the patient. And I think that was kind of the turning point when everybody realized that we had to do the right thing.
The trauma center, there was competition between hospitals there, Maggie.
Yeah.
And basically all my dad ever said is may the best hospital win.
Eric Freed, Sonoma County paramedic and later became vice president of operations at REACH Air Ambulance and is now the senior program director over Northern California of Global Medical Repose REACH.
That's why we love Dr. McDonald. He wasn't afraid to push the boundaries to do what was right for the patient.
Yeah. Tucker Beerbaum, emergency department physician, Memorial Hospital in Santa Rosa, was the medical director of paramedics for EMS in Sonoma County, was the representative of the medical board in Santa Rosa Neighborhood Helicopter Committee, was the emergency department representative to the trauma team for 20 years.
30 years ago, if you were hurt bad, you had a 20% chance of dying. Now, if you're hurt bad, you got a less than 2% chance of dying. It's just the development of specialty hospitals for trauma.
Unfortunately, once REACH aircraft started, the neighbors weren't exactly thrilled about the noise that was caused throughout the day and night. Dr. McDonald struggled because his hope was to make everybody in the neighborhood happy. Because of this, they compromised on a weekly meeting where the neighbors could come together and complain about what they didn't like about REACH. The staff, who listened to them, then brought it to higher authorities.
So remember, the first compromise was limits.
Yeah.
Right. The second compromise was neighborhood review committee. And the third compromise was we said, okay, we will create a class of patients that fly in by helicopter to Memorial Hospital, but they don't land at Memorial Hospital. They land at the airport.
So I guess when it comes right down to it, from the time someone gets sick or injured to the time they get to definitive care, there's an amazing system in place to take care of them and to try to maximize the likelihood that they don't die and they're not disabled. And,
Yeah.
and I think that might be his legacy, Maggie.
Barry Smith, emergency medicine physician at Santa Rosa Memorial Hospital.
As far as the paramedic program is concerned, it was kind of the realization that we could take advanced medical care outside of the emergency room out into the community. We could take it to the patient who was sick or was injured. So that was really a good thing.
We had a preventable death rate in the county at around 17%. So that meant that 17% of the people who could have survived their injuries went on to die.
Always do what's right for the patient.
Mm-hmm.
Always work together as a team.
Mm-hmm.
Don't let bureaucracy and other things get in the way of patient care.
Patrick McDonald, son of Dr. John McDonald, and was the president of Reach Air Ambulance.
We're lucky to start a paramedic program early to train paramedics. We were lucky to get a helicopter that could go all over the county and save people. And we are lucky that we have a trauma center at Memorial Hospital to take care of those people. So everybody in the county, no matter where they live, has a good chance of surviving a traumatic event.
Gary McCullough, emergency medicine physician and was the former medical director of Reach Air Ambulance.
It took somebody like Dr. McDonald's persistence and willingness to get it started, and that it was a kind of a long, hard fight for him. But in the end, they were all successful, and Sonoma County has much better emergency medical care.
The emergency department was started in 1971 at Santa Rosa Memorial Hospital. The paramedic program started in 1977 in Sonoma County. Air Ambulance, also known as Reach, started in 1987 in Sonoma County. Santa Rosa Memorial Hospital became designated trauma center in 2000.